Hi, everyone, and welcome to today's HealthLinks webinar, The State of Workplace Mental Health. It's great to see everybody joining us. For those of you that are familiar with the process, if you want to use the chat to tell us where you're joining us from, we'd love to see all the states and countries coming in through the chat function. So my name is David Shapiro. I am a white male in my late 40s. I use he, him pronouns, and I am successfully living with generalized anxiety disorder. I have dark brown curly hair, a brown beard, and today I have large gray rim glasses. A few housekeeping items. All of our participants are on mute for the duration of today's webinar. We want you to use the chat function, one, to introduce yourselves and tell us where you're from, but also for any technical assistance questions that come up. We have a team helping us support any technical assistance here. If you have questions for the presenters on today's webinar, we ask that you put them in the Q&A section of Zoom so that your fellow participants can vote using the thumbs up button and don't have to type the exact same question. It helps us during that portion of the webinar. Closed captions are available. Please use Zoom technology for closed captions if you need them. And then we know so many of you are here to claim continuing education credits. Please stick with us to the end of the webinar when a survey should pop up. We need your responses on that survey to acknowledge your attendance and be able to send you a link to your continuing education credits. And then also, we are recording today's webinar. You'll get a link to the recording, and you'll be able to share that with your colleagues as well. HealthLinks is a public health outreach program. We're located at the Centers for Health Work and Environment at the Colorado School of Public Health on the University of Colorado Anschutz Medical Campus in Aurora, Colorado. Total worker health is what we do. We help organizations on their commitment to worker health, safety, and well-being in a variety of ways. And mental health is a really important conversation for us and for employers in our network, in addition to chronic disease management and prevention. But today, in honor of May being Mental Health Awareness Month, we're excited to have some really great panelists speaking about the state of workplace mental health in 2025. We always start with the University of Colorado's land acknowledgement. I'll read that now. As we gather, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories of and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of indigenous peoples recognizes the original stewards of these lands and their legacies. With this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse Indigenous people still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native people. A disclaimer about today's webinars. It is about mental health. We will talk about stress management and challenges to mental health in the workplace. If you feel like yourself or any other individuals that you're with are experiencing a crisis, please use 988. But the views and opinions expressed today represent myself and our individual speakers, not our organization, HealthLinks, the Colorado School of Public Health, or more broadly, the University of Colorado or the Centers for Disease Control and Prevention. So we'll have a keynote presentation in just a moment. We'll have a discussion with a few leading individuals in the field, and then we'll have time for the question and answer section as well. Our objectives today are for you to better understand the state of workplace mental health in 2025 and in the upcoming year. Hopefully, you can discover and understand some new approaches to strengthening the mental health support within your workplace, and then also that you can articulate mental health for a variety of different populations as part of your diversity, equity, and inclusion efforts. With that, I'm going to introduce our keynote speaker for today, Clare Miller. Clare is an expert on workplace mental health, having dedicated over 25 years to helping employers improve access to quality care and address barriers to well-being. Clare recently founded Workplace Mental Health LLC, a consultancy to support employers and stakeholders to advance mental health and drive business results. Previously, Clare served as the Global Mental Health Benefits Manager at Meta, leading the company's mental health and well-being strategy for over 65,000 employees worldwide. She also established the Center for Workplace Mental Health at the American Psychiatric Association and worked at the Business Group on Health, focusing on public policy, mental health, and substance use disorders. So Clare, I'm going to turn over controls to you. Thank you so much for joining us today.
Thank you so much. I'm delighted to be here, and I've seen some of the names coming in and I recognize some of them. And so I know that not only am I speaking alongside experts as panelists, but we also have a lot of experts in the virtual room here. So looking forward to the discussion as well. Sorry, there we go. So my pronouns are she, her. I'm a white woman in my very, very early 50s with dark hair and glasses and a green shirt on today. I also live with anxiety and depression, and that has very much informed my career, and work has actually been the thing that originally sort of got me to get the proper treatment. And so that really is a sort of undergirds my passion and interest in this space, recognizing the power that employers play. So what I was thinking as we were getting started is just to sort of make a global statement that there's kind of a lot of bad news here. Things are not going so well. There's lots of challenges. But as we go through some of those challenges, starting with, sort of the context, and then some of the things that, I think we should be thinking about as we think about mental health and work, there's also some really good news. And the good news, in short, is that much like mental health services can pay for themselves in terms of reducing costs elsewhere, productivity, absenteeism, medical leave, et cetera. Similarly, the interventions that we can do to improve work itself can also improve business performance. So please do kind of keep that in the back of your mind to temper some of the challenging reality that we're going to cover here today. I also just want to acknowledge that I'm looking forward to the interactive part of this, and recognizing that my perspective is coming from a very particular orientation, and that really our best thinking is to think about all of the different ways that we should be thinking about this and drawing from everyone's expertise. So I think,
hey Clare, there's a couple gray boxes on your slides. We can see the bulk of the slide, but there are a few gray boxes. I don't know if that's on our end or on yours, so I just wanted to let you know.
Maybe I should try resharing. Okay. Let me see if that works. Hopefully it's not. Did that help?
I'm not currently seeing your screen, but.
Okay, let me try this again. Oh, someone just said they can't see my slides. Okay, let me try shutting it down and starting over. Sorry, we practice this, of course. It always comes down to tech, doesn't it?
It does, and I think in honor of Mental Health Month,
yeah.
Take your time, and technology is consistently part of stress management for us. So
exactly. Okay, let's see. What about now? Can you see my slides now, David?
I can. There's just some gray boxes. I'm not sure if that's part of your program or.
It sounds like some of it might not be.
But most of the content is there. So let's move forward and not worry about the gray boxes.
Okay, sounds good. Okay, my apologies. And I know the slides are going to be made available, I believe, right, David?
That's correct. We will share the slides afterwards.
Yeah, and I guess another note just to be mindful of is that there's a fair amount of data, but I'm not going to go through every single line. I'm hoping to talk more, conceptual, but wanted to make sure data was available for folks who want it. So in any case, sort of some headlines are, thinking about mental health. There are continue to be a lot of challenges with connecting people to care, but we do know that when people do get care, there is a return on that investment. In addition, another very problematic headline is that employee engagement is at a record low. And we'll talk more about this and some of the implications, as well as some of the ways that this can be addressed. So I wanted to start with just sort of talking about workplace mental health in general, and what does that term even mean? And really, I think a lot of times, depending on the orientation, if you're in the benefits department, you're going to be thinking about, your employee assistance program, your medical benefits. If you're in, focused on safety, you'll be looking at it from a different aspect. But the term workplace mental health is envisioned to really think of all of the different ways that an organization can impact someone's mental health and well-being, from the environment, culture, job demands, leadership, organizational practices, and management, and of course, benefits as well. And I do believe that in the United States in particular, we've spent so much time talking about access to care, which remains a massive challenge, but we haven't talked enough about the work impacts. And so that's part of what you'll see me sort of doubling down on today is, talking more about work. And we know also all of these things are so interconnected. So mental health impacts work. This is quite well known, but in particular, if mental health is poorly managed or is not diagnosed, it's a chronic condition. These are in many cases chronic conditions, and so there will be ebbs and flows. And there are clearly impacts to work when things aren't going well. And this shows up in all sorts of different line items, from productivity, medical costs, absenteeism, et cetera. And most to the point, I think, is that it affects human beings, and we're all human beings. And while there is a business case to be made, there's also certainly a human case to be made for helping people to connect to treatment as early as possible. Unfortunately, we know that a lot of people don't get treatment. The average delay between when someone might begin to have symptoms to getting connected to care is often more than a decade. And then we also know that when people do finally sort of decide, I'm going to reach out for help, that is often not a good experience. It can be very difficult to connect to good care or to connect to care at all. And there's lots of complexity for why that is, but barriers include costs, wait times, shortages, et cetera. Another area which is very much within the employer's control is concern about actually being fired for taking time off for appointments or having some sort of negative work impact. And that's an example of something that is within an employer's control to impact that in a positive way. Another really startling statistic that I will read is mental health leaves. Mental health leaves, this is a striking number, have increased 300% between 2017 and 2023, and even increased 22% in 2024. And so clearly, while there is much increased awareness about mental health issues, better access, not perfect at all, we still have a lot of work to do. And I've talked a little bit about this already, but basically, I really think it's important for employers to be thinking about all the different ways that you can impact mental health, from benefits, but also work experience and management practices. And so if we think about work, work is not in and of itself bad. Work is actually very good in many cases for us. We spend a huge amount of time at work, a third of our lives. It's not only a source of income, purpose and meaning, structure, connection. It actually is considered a social determinant of health. And if you are doing well at work, if you are thriving at work, you actually are going to see well-being, physical and mental health gains. And people, this is not really shocking information. 60% of employees will say that work is a significant factor in their mental health. Unfortunately, and I highlighted a little bit of this earlier, but we are seeing record lows in terms of employee engagement. And to be clear, I don't mean engagement in mental health services, I mean engagement in work. In addition, respect at work is also at record lows. And we have, unfortunately, worse mental health than we sort of ever have been before. And some of this is, there's lots of reasons for this. The pandemic, a lot of just uncertainty in the world. But unfortunately, this increase in knowledge and awareness isn't translating yet to actually better mental health for folks. And part of that is how we work. This is, I think, a striking number that should stop managers and leaders in their tracks, and one that I think we should be talking a lot more about. And that is, do people even know what is expected at work? Less than half of people know what is expected of them. And you can just think about all of the, all of the things that will come out of just that one statistic. If you don't know what's expected of you, you're going to have uncertainty about whether or not you're doing what is expected of you. You're not going to have role clarity about where you begin and end in terms of your role, about how you're supposed to work with others. So literally just this one stat, do you know what's expected of you at work, is really a signal of many, many problems and many other symptoms related to this core root issue. Work conflict, political issues within the company. How much of this is related to this basic fact? And here's a stat that or a quote, excuse me, that I think many of us can relate to if you've worked in different organizations where there's not clarity about who you should be listening to. There could be conflicting information. And the natural reaction to that is to pull away, is to lose motivation, because otherwise you are going to be in a position where you feel bounced around and you're not quite sure what to do. Another really significant fact is, do people have the resources to even do their job? 1 in 3 have the resources needed to do their job well. And this can be physical equipment, tools, etc., or it could mean getting unblocked with a particular issue that needs a decision, or lack of clarity about what the current priorities are, support from your manager resolving specific issues, that sort of thing. And here's an example, which I think is just a quote, which I think is just so striking, because this person is a maintenance manager and they literally do not have the spare parts and tools to do the core work. So that is going to result in all kinds of challenges in terms of talking with folks who are upset that the thing is still broken, trying to save face for the company about why that's the case, et cetera, et cetera. Another key issue, and we talk a lot about burnout. We've talked a lot about burnout in particular industries and populations, healthcare workers, for example. I think there's widespread awareness of the challenge of burnout among healthcare workers, as well as other sort of helping professions. But I think that it's useful for us to really get to the core of what burnout actually is. And it is very clear, the World Health Organization came out a number of years ago clarifying that burnout, the definition of it is chronic workplace stress that hasn't been successfully managed. And it shows up in different ways, including feelings of low energy exhaustion, mental distance from one's job, feeling negative or cynical about your job, and really just reduced efficacy. It's important, especially for folks in HR, managers, et cetera, that if you see that an employee is showing signs of burnout, to make sure that that individual is getting connected to support. Lots of reasons. 1, because you want to be a good human. 2, because these symptoms could be masking or could look like other mental health or medical issues. And so it's important to make sure that that person is directed to support for that, as well as legal reasons, making sure they're aware of accommodations, et cetera. But most fundamentally is looking at the work factors that might be relating to this person's burnout. If one single individual is experiencing burnout and no one else on the team is, that could suggest many things. Maybe that person could improve some of their relationship with work or prioritization, et cetera. If there is widespread burnout, then that suggests that there are work factors that are impacting a number of people at different stages, and that really you need to have a more systemic approach to addressing it. And so what causes burnout? And I think a lot of times we think about, well, you just have long work hours and there's too many things to do. And the common problem that people are in meetings all day and then they have to do their work. But importantly, burnout is not just about hours, it's about how that work is actually managed. And so it's these things like workload, control, et cetera, et cetera. And so the core thing to think about is, what's going to reduce work stress is addressing work. addressing work stress with a well-being program that only is targeting what the employee on their own can do for their work-life balance, meditation, etc., is actually potentially going to work against the company, because it will be seen as sort of not addressing the actual core problem. And so we know from research and lots of data and lots of good management practices that these things are the things that can actually reduce work stress. So doubling down on those and not leading with just stress management techniques is really, really critical. And this is just sort of a similar kind of idea, but just to be very careful that if you are talking, and especially during May is Mental Health Month, there's such an emphasis on mental health services. But if you are only talking about mental health services and you are not addressing and talking about whatever might be going on in the company, it can actually make things worse, because folks feel that the company is investing in sort of the wrong things. And so I'll just sort of end with this quick story. Basically, employees were asked, what can we do to help you? The answer was gloves. I want work gloves. They'll help me do my job faster, better, safer, etc. And then the well-being team, well-intentioned, sends yoga mats to everyone. And this is, I think, a nice metaphor from Gallup about the ways in which we can really be changing. So I will turn it back to you, David.
Thank you so much, Claire. For audience members, just remember, if you have questions based on Claire's presentation, please put them in the Q&A box. Most likely your fellow participants have similar questions, so you can use the thumbs up if you want to ask that question. We do have 2 more speakers before we get to the Q&A, so feel free to start putting those questions in the Q&A box. Our next speaker is Morey Riordan. Morey is CEO of Mindshare Partners. He has spent his career as the senior leader at nonprofits focused on health equity. Most recently, he founded and led the Transgender Strategy Center, or TSC, providing strategic advising to major corporations and large foundations around creating welcoming workplaces for transgender employees. As Vice President of Access and Innovation Grantmaking at AIDS United, Riordan worked to improve the health outcomes for people living with HIV/AIDS nationally, overseeing multiple national grant-making portfolios. Morey serves on the board of directors of ETR, a national health equity organization, improving the health and well-being of youth and communities by championing science. Throughout Morey's career, a focus on the mental health and well-being of communities being served has been a significant focal point. So thank you, Morey, for joining us today. I'm going to go ahead and share your slides.
Great. Thank you, David. I'm really happy to be here today and be a part of this session. So thank you to Health Links for inviting me to join. And really just want to say at a very high level, some folks are familiar with Mindshare Partners, but really we focus on 2 tracks of work. One being a tailored consultation around shifting workplace mental health culture. That's individualized coaching, trainings, and then also we do movement building. We're really working on combating stigma around mental health in the workplace, and we do that through research, which I'm going to share some with you in just a moment, media pieces, and then we also do a leadership campaign called Leaders Go First, where C-suite level folks really share their own mental health story to break down taboo and stigma in the workplace. And I would say, I want to include, I'm going to loop back just for a minute to say, and forgive me for not starting with this, that my pronouns are he, him. I am a white male, age 62, with dark hair that is rapidly graying. Today I'm wearing red glasses, and I live with periodic clinical depression. So let's look at starting to really look at some highlights from our recently released last week 2025 Mental Health at Work report. And I said to my teenager, I'm excited about this report. It's hot off the presses. And he looked at me with a blank stare until I said, oh, it just came out online. So those of you who are my age, it's hot off the presses. This has been out for about a week, and really we've done national polling with workers across the US in partnership with Qualtrics to get this data. So similar to Claire, I'm going to say we have some worrisome results for sure. Across the workforce, things are not well, but there also is going to be some good news I'll talk about. So fear not. You're going to see on the top blue bar that 90% of workers we polled across the US are facing significant mental health challenges in the last year. 90%. Under that, you're going to see where they categorize their challenges, with burnout leading, depression, and anxiety. They're all fairly close together, but 90% is a pretty stunning number and the highest number we've seen to date in our polling. To the right of the screen, you're going to see the top stressors that folks identified that are following them into or coming out of work. And the top one is US politics, followed closely by global events, and then personal finances. I want to say that personal finances has been a consistent one over time in our surveying, but the US politics and global events have risen to the top quickly. We just haven't seen those in the mix of top stressors before. And so I think, many of us, we know that we are in uncertain times, but this finding really, really validates that folks are worrying about that in the workplace, as well as generally. And next slide. Okay, the good news. The good news is that investing in mental health pays off for employers and employees. If you look at the blue bars, these are responses by workers who really believe their company or organization supports their mental health. They're showing lower levels of reported burnout, much more trust for leadership in the organization, and they intend to stay at least 2 years with the organization. So those are, particularly those last two items, really jump out as the difference it makes when an employer invests and shows they care about mental health in the workplace. Next slide. So another really clear result from our survey, and let's just acknowledge diversity, equity, and inclusion has become a hot topic, with companies really navigating this in a range of ways right now. And I think the top stressor around US politics really intersects with this issue. But what our survey found is that the vast majority of workers across the country support fairness and inclusion. They support things like protection from discrimination, fair hiring, and a fair promotion system, people with disabilities having accommodations, and they have interest in learning about different cultures and identities. So this finding in some ways cuts through some of the noise perhaps in moments about DEI, and is something that we were really interested in seeing in this moment. Okay, next slide. As Claire mentioned already, benefits are very important, but they have to be a tool in a larger toolbox. And we see when we ask workers what is most important to them, number one is work-life balance and flexibility. This is a huge one. And then we move to safety and talking about mental health in the workplace. Is it a safe culture? Can folks share their story? Can they ask for some time off without being concerned about a punitive response if it's related to a mental health challenge? Another big one. You'll see the benefits in the mix, and then self-care resources. That might be some of the meditation apps or other things that Claire mentioned earlier. And I want to call your attention to the bottom left side of the screen. Another important finding, that a little under half of the workers surveyed felt they could truly disconnect after hours from their work or even while going on vacation. Again, this is another factor that is showing up significantly and really, I think, threatens the overall well-being of workers in the US. Next slide, please. I want to just close by saying most of us, you saw the slide, are experiencing mental health challenges. And we are not alone when you look at that 90% finding. I want you to think about if 90% of your close personal network let you know that they were having a significant mental health challenge in the last year, you might want to dial 911. This is what's happening in the workplace in the US. And again, Claire talked about how much our work experience takes up in our life, but also impacts our well-being. And if you look at those top three stressors, the US politics, global events, and concern about personal finances, none of those are going to change overnight. Right now, we are in this moment, and it is likely going to continue for some time. The good news, I want to say again, is that with relatively low investment, employers can really make a difference in the mental health culture in their organization. I just want to encourage you to go to our website where you'll find the report for this year. You'll find past reports. There's also some free resources you can download, for your own workplace. And you'll see some upcoming trainings coming through Mindshare Partners. Thank you.
Thanks so much, Morey. I'm seeing lots of great questions already coming in the Q&A section. I'm excited to introduce our third speaker, and after Daniel's remarks, we'll get into the Q&A. So again, if you have questions, we may not be able to get to all of them, but you may see that some of your fellow participants have already asked a question that's top of mind for you. Feel free to use the thumbs up feature on Zoom so that we can start to prioritize the questions that are there. I'd like to introduce Daniel Ward. Daniel is a recipient of the President's Lifetime Achievement Award from former President Joe Biden. Daniel is an inspirational influencer for positive self-actualization. In 2005, Daniel founded Inward Fitness and has worked with individuals to enrich, enhance, and optimize their health and well-being as both a fitness and wellness entrepreneur. Knowing the importance of physical health and fitness, Daniel also emphasizes the significance of mental health fitness in enhancing performance, leadership, relationships, and overall well-being. Daniel has worked closely with a diverse range of clients, including politicians, musicians, CEOs, attorneys, and other high-performing professionals, as well as associates, athletes, sports teams at various levels, and law enforcement personnel. Thanks, Daniel, for being here.
Thank you. Excuse me. Thank you, David. Thanks so much for having me. Good morning, everybody. I'm very happy to be here. And I'm going to go ahead and share my slides. As an intro, my name is Daniel Ward. I'm the owner of Inward Fitness. I am a biracial man, 44 years young, and very happy to be here again today to talk to you about mental fitness. Okay. I had a client tell me one time, I want to be more fit. And I responded and said, what does that mean to you? And in the same, if I asked any of you if you're fit, some of you may say, yeah, I do yoga, I run, I lift weights, I swim, dictating that something physically active that you do means you're fit. But if 20, 50, or even 100 of you got together, how would you define physical fitness and the characteristics and what it means to be physically fit? And what you personally do may not make the list, but what about the capabilities and those capabilities that you don't do? So I liken this to mental fitness. And so what does this mean, and how mentally fit are you, and how mentally fit is your organization? So what is mental fitness? Mental fitness is the ability to use your cognitive and emotional resources to handle life's daily challenges, to develop thoughts, emotions, actions, and behaviors in a way that supports well-being, resilience, and productivity. And the important part here is these thoughts, emotions, actions, and behaviors equate to patterns, and we all have certain patterns that we operate in. So what's the impact of good mental fitness? Well, personal and professional performance, your overall well-being, and cultivating and maintaining healthy relationships. And why does this matter? This really matters because we need to be able to adapt to uncertainty and change. And I'm going to say that again. We need to be able to adapt better to uncertainty and change, individually and collectively in our organizations. And so the stats Clare and Morey have mentioned, I'm not going to go into, but we know mental health is important. And I believe a major component is developing mental fitness. And so what are the tools you gain when you become more mentally fit? You're able to stay calm or more calm under pressure or high pressure situations, stressful situations. You can embrace uncertainty and change better, not to say that it's going to go away. Those are constants in our lives, but to be able to embrace it better. And you can bounce back from setbacks. So for the last 20 years, I've been helping people achieve physical goals and all the while been training them to be mentally fit as well. And yes, I know building physical fitness also helps build mental fitness. So I encourage you all to individually engage in physical activity as an outlet resource to help that as well. For example, when you aim to achieve something physically, you set a goal, become committed to, and physically do what it takes to achieve that goal. And some days are good and some days are not so good. But in the end, you achieve the goal. And for me as a coach, I'm with you along the way. All the while, you've been developing your mental fitness, building awareness, focus, clarity, creating consistency and resilience and perseverance, managing the difficulty of the goal, therefore making you a more adaptable person and building your ability to regulate your emotional responses. And so we do need to train our minds, just like we train our bodies. But insight provides only so much, and it's great for building self-awareness, but then what do we do from there? And so I'm always reminded about this quote. It says, "We judge others by their actions, and we judge ourselves by our intentions." And so we have to put our insight into practice. If you recall the example of attaining a physical goal that I just spoke about, physical fitness is a collection of many capabilities, such as strength, endurance, mobility, flexibility. But mental fitness is a collection of capabilities such as the following: self-awareness, which I mentioned earlier, emotional regulation, presence, focus and clarity. My favorite, number 4, which is positive mindset, cultivating visualization and manifestation. And then number 5, resilience and perseverance. So let's not continue to talk about mental fitness. Let's actually do it. And so I'm going to give you some instructions here to actually do a mental fitness repetition here. So when I ask you or tell you to rub your index fingers and thumbs together, I want you to do this. But don't worry, you don't have to hold your hands and your arms up like this. I just want you to keep your hands in your lap. And yes, I'm going to ask you to close your eyes when I count down from 3 to 2 to 1, and then you'll effectively be hypnotized and everything will be better. Just joking. But we know the assignment for this, okay? And we're just going to do this very briefly. So I'm going to have you get comfortable in your seat if you're not already. And I want you to close your eyes in 3, 2, 1, and close your eyes. I'd like you to feel the weight of your body in your seat. Paying attention to the temperature of air as it enters and exits your nostrils, I'd like you to take 2 deep breaths. And after that second breath, please return to your normal breathing. Shifting a little, I'd like you to rub your index fingers and thumbs together with such attention that you can feel all of the physical sensations: the ridges, the rough spots, soft spots. Relaxing there, I'd like you to again pay attention to the temperature of air as it enters and exits your nostrils as you take 2 more deep breaths. And in 3, 2, 1, open your eyes. I'd like to think that you may feel a bit more relaxed physically and mentally after that, and maybe your mind's a bit more clear, and potentially the noise has been lessened. And congratulations, this is the start to training your mind to be more mentally fit. So overall, how do we become more mentally fit? Well, for us as individuals, we need to do the work and do it for ourselves. Just as you can build physical fitness, I would challenge you to move your body with intention, doing anything you'd like to do that's physically active. And from a mental fitness aspect, the mental fitness repetition that we just did was about a minute in length. And this tool has been very, very effective, and many have put it into practice. So I would highly encourage you to put it into action when you need it. The beauty of this trick is you can do it when you're stressed, when you're anxious, when things are uncertain, and also do it when you don't need it. Let's develop the practice to do the repetitions. And we're not going for perfection, we're going for progress. For organizations, I'm going to say embrace the messy and don't copy. No two organizations are the same, and every organization has some element of dysfunction. So I think embracing the messy and building on the mission and vision of the company is important. There's nothing bigger than this, and I think this continues to build culture around it. That's number one. Number two, I'm asking organizations to invest. As Claire mentioned, a third of our lives we spend at work, and what Morey showed just recently to address the top stressors shown, we need to invest in it as organizations to make sure that it is a cornerstone for your employees, for the associates, and your team members to build mental fitness. It takes real dollars and real time. And let's face it, we all need a coach at some point in our lives, and individuals need that help. And I think from both, we need to model from the top. We talked about EAP. If you're a decision maker, I would encourage you to know exactly what your EAP provides, but maybe potentially those holes in there are things that it doesn't provide. And outside of this, I'm asking leaders to show and tell, to step up and show and tell. Because I believe at the end of the day, we all want the following when it comes to our workplace. Number one, triple purpose. Purpose for the individual, the team, and the organization or enterprise as a whole. Second is earned trust collectively, healthy conflict, and mutual accountability. Thank you so much for allowing me to speak today, and I will stop my share now.
Thanks so much, Daniel. Thanks for walking us through an exercise as well. That's really helpful, and I hope it's something that people can put into practice as you go about your workday or work week. I'm going to ask Morey and Claire to rejoin us for this Q&A section. Again, if you have any questions, we have several in the Q&A, but if you have any questions, please put them there, and our colleagues can use the thumbs up feature to vote on them as well. I'm going to try and summarize a bit of a dialogue going on in the Q&A between Amy and William. Thank you for these questions. I'm going to start, Morey, I think with you on this question, and I'm going to go from you, Morey, to Claire as well. So what are some suggestions, since Mindshare Partners works directly with leaders and at the organizational level, what are some things that we should be considering as effective to create leadership buy-in or more broadly organizational buy-in on even focusing on mental health or some of the workplace factors that Claire described? What, if someone was going to go to their leadership team after having participated in this webinar, say, I think we need to invest more, or we need to invest something in mental health. I'm willing to work on this. Where would you have them start? Or what are some things they should think about for that conversation, Morey?
Well, I would probably recommend not going in with a stack of research, but really perhaps pulling some key slides or pieces from this session to look at the research that supports the shape that employers are in right now, right? And so I think it is helpful for at times C-suite folks to see there's actually some data behind this, both the scope of the problem, which is pretty unprecedented in what Claire was sharing, and as well as some of our data. So briefly, just highlighting that, I think that tying it to values that are clearly probably stated around what companies and organizations want for their teams, really linking it to that. And then I do think that the one slide, at least, or finding in our slide set, was the one where workers, it's so stark what workers at organizations or companies who see support for mental health report in terms of burnout, in terms of trust of leadership, and in terms of retention. And those, frankly, are bottom line costs for employers. So we still need to make the case of what the kind of fiscal impact of investing in this in addition to values would be. And I'm curious to hear, Claire, your thoughts.
Yeah, I'm going
Yeah,
to turn it over. Go ahead, Claire. I was going to turn it over to you. One thing I was going to say as you're thinking about your responses, as an advisor and consultant in this world, whenever I go to an organizational leader, if I can help understand where the pain points, or in safety terms, where the pinch points are, in order to better service the organization, that's, starting with data, whether it be data from the field or data within the company, is always a great place to start. Of what problems are we trying to solve today? And Claire, another thing that came up is the current environment. There's a lot of budget constraints, and so how do we keep that in consideration as well? Claire?
Yeah, thank you. I agree with much of what you both said. In particular, the idea of don't come in with a big framework and 50 50-page slide deck on data. I do think it's important to, I think, starting with whatever the company is currently facing, those existing like big macro problems, like, we want to win an XYZ thing, and then pointing out the data, ideally data from within the company, that says we're not going to be able to win with this thing that we want to accomplish on the business side if we don't pay attention to how work happens. I also, and this is maybe a little going to be jarring, but I almost think that we need to leave out a lot of the language around well-being, because I think that when we talk about that, it sounds very soft to a lot of leaders, I think, and that we want to sort of take it easy on folks, et cetera, et cetera. And really, I think if you look at burnout, for example, this isn't about, giving everybody more perks. This is about having clarity on what are the current priorities, what is no longer a priority, having, standard communication practices, transparency, openness. It's about how the work is actually getting done, that is creating the problem. So doubling down on that, and all the solutions that will come, the solutions that relate to improving the work, a byproduct of that, a wonderful one, is improving well-being. So just sort of framing the conversation, I think, in a different way can be useful.
Daniel, you work with a lot of leaders and high-profile individuals. Any suggestions on what's been helpful to get more buy-in around either defining what mental health is, because that's come up here in the chat, is not everybody knows exactly what mental health is, but also like to invest in it either personally or as at an organization a little bit more. Any insights for us there?
Yeah, I think it's a great question. And I think, to be honest, and Claire, I appreciate your comments about something being jarring. I think mental health is still jarring for a lot of people to consider and to talk about, especially at higher levels. And it's one of the reasons why I'm really trying to focus on mental fitness as an aspect and a component of mental health, and how you can kind of relate the physical fitness to mental fitness and create that kind of crossover understanding between the two. I think with some of the folks I've worked with, I think a big part of it is a real call to something that's bigger than you. And that's why I spoke a little bit about the mission and the vision. And Morey, you mentioned this as well. I think when we have a collective vision that's bigger than just one individual, there's more buy-in around this aspect of mental fitness and mental health. Claire, you just kind of spoke about that as well. We need to understand, certain fiscal aspects and economic aspects. But at the end of the day, if we're trying to move an organization to the next level, okay, well, we need to maybe take a big step back and look at really what our mission and our values and our vision is of the company, and how we're bringing everybody along with that. And the International Coaching Federation, they've also come out with some studies, earlier this year, talking about the need for mental fitness coaching for teams and individuals within the workplace. Instead of just doing, a 6 or 8 week stint, there needs to be more dedicated ongoing resources to this type of thing as well.
Thanks, Daniel. Really appreciate that. This idea of mental fitness, I think, is an important one. We talk about physical fitness and exercise all the time, and I think we don't have as straightforward of a framework of what that looks for psychological or behavioral health. So I appreciate you bringing that to the forefront for us today. Claire, this next question, I'm going to start with you, because I imagine you've had this experience before. let's say an organization is launching a new program, whether that be an EAP or a fitness program or peer support. What are your, so you've made the pitch, the organization is ready to go, they're launching a new program. Any suggestions on ways to roll it out that would increase buy-in or support for the organization, especially related to something mental health?
I think, and this is maybe a global comment that might not relate to every single company, but certainly many. I do think with the current environment, it's important to launch that program in the context of what's going on in the world or with the company. If you sort of just trot it out as this fabulous thing, which it likely is, but you don't sort of acknowledge the context of, there's a lot of challenges right now. The company's, sorting through, XYZ, some of the business context first, because I think that otherwise it sounds like the message, well, I know the message will land in an unexpected way. It will land as, if you can't hang with this uncertainty, go seek mental health support. And obviously that's never the intention, but that can be the way in which it can backfire. So that's what I would say, is just frame it within what's going on in the world and at the company. Or if you happen to be at a company, and if so, we want to hear about it, where you don't have your, protected against all of this uncertainty, then that might be less of an issue. But
yeah, I really appreciate that. Daniel, I'm going to ask you if you have some suggestions as well, because I know you launch programs at organizations. But before I do that, one thing I've been working with a number of companies, especially leadership at companies on, is talking about how a new program or a new support is impacting ourselves individually, rather than saying, hey, team, I want you all to do this because I think it would be valuable for your mental health or well-being. We talked about leadership vulnerability, leaders being willing to talk a little bit about their own experience in mental health. We've seen a shift for some organizations we work with it, rather than saying, hey, I want you to do this for your self-care, of saying, here's a new program we're invested in. I'm participating in this for the following reasons, and I invite you to join me in a conversation about mental health, or whatever the new benefit may be. And that seems to have a little bit more I'm being encouraged not to use buy-in, but a little bit more focus on employees and the system, rather than saying, hey, this is something I want all of you to consider as employees at this organization. Daniel, do you have anything you want to add about launching a new program, or maybe even launching mental fitness at an organization, and some things an organization can consider?
Yeah, sure. No, I'll kind of echo what Claire said a little bit. I think, unfortunately, with change and uncertainty, buy-in for these types of things gets disrupted, to be honest. I think really it does come back to, that leadership initiative, and again, those mission and vision statements and values of the company, and listening and addressing the why, listening to your employees. What exactly do they want? They don't want yoga mats if they need gloves, right? I love that analogy. And I think over the last 20 years of building my business and working with individuals and organizations, I've always listened to the people. The people will tell you what they want and what they need. And I think if we lead with that, you're almost unable to fail, right? Because if you give the people, it sounds so cliche, but if you give the people what they want, they will be excited to come to work. They will want to work hard. They will want to produce. They will feel that sense of purpose individually and collectively within the organization. And so maybe I'm real old school, but that's been very successful from my point of view, and just listening to what companies and organizations really want and need. And I think mental fitness and mental health is no different when it comes to that conversation.
Thanks, Daniel. Shifting gears a little bit, Morey, I'm gonna come to you with this next question. I know that you run an organization that does consulting, but on mental health. But we've had a question come up, and I think this is really relevant for people right now, that times are difficult. And I know you've written some articles recently about the stress of the current day and the current environment. And I think people are finding some challenges just disconnecting from the reality of the news, of what's going on in the workplace. And even as well-being professionals, as people in the total worker health space. I mean, I'm an occupational health and safety professional, and what's been going on with the occupational health and safety profession has been, devastating to so many people in my field. And there's been so many groups that have been impacted by the current environment. So I'm just curious if you have any tips for ways in which Mindshare Partners is helping encouraging people to disconnect. Daniel walked us through some exercises, but what are some ways maybe even perhaps you disconnect if you're willing to share with us? But how do you get yourself in a mindset or a frame to be able to approach these conversations when everything seems so and feels so chaotic?
Yeah, thank you so much for that question. It's very timely. And um, trying to disconnect right now feels like it's not for the faint of heart. Um, I woke up on New Year's and my New York Times news app no longer worked. And it took everything I had to not get it fixed and decide that I was actually spending an hour and a half a day looking at news was not good for my mental health. And so I think, just globally for us to think about how much, titrating, how much we want to absorb, whether it's conversation at lunch, at work or otherwise, what's that balance to kind of stay informed, but not overdo it for your mental health. I recently, I actually had an employee recommend this to me, seeing how packed my schedule looked, and was to take no meeting Fridays. And I know that's not possible for everyone, but it's making a huge difference. I think the culture of disconnecting has to be a shared one among your team. That it's almost like what are our shared ground rules around when someone takes a vacation? Maybe we don't each send 5 emails a day to them so that if they're tempted to look, they're not going to feel overwhelmed and run for the hills rather than want to come back. Can we hold that while people are out? And then also, I think something I like about Mindshare Partners is we are a remote organization that does some meetings in person each year, and really we have part of the day that is just focused on fun and connection and laughing together and sharing. And what we hear from the team and what we've heard from companies that do this is it makes a huge difference, particularly in this time. I think when people are really wanting community and connection to get through this moment.
Appreciate it. I love this idea of working on fun. We see in the chat that the survey for feedback link is not working right currently, so we will get that fixed and get it uploaded as soon as possible. So I'm hoping that the new link that was just put in chat will work for everyone. Thanks for your feedback. Daniel, any tips for disconnecting? I know you walked us through a mindfulness exercise. In the next minute or two, you got any other wisdom tips for us?
Yeah, I'll actually agree with Morey. Honestly, we work with a lot of organizations and companies in around town in the state of Colorado, outside of the state as well. And when we bring some of our corporate wellness solutions and services there, we put a big impact and focus on spending time together outside of the office. So we do field day events. We come up with creative solutions to get people out and about, something that may be slightly active, but if that's not your demographic or your workforce, that's okay too. But to get out and do something together and create those social bonds, because I mean, let's face it, COVID was 5 years ago, but we've still become isolated in silos because of our hybrid work environments, and I don't think there's necessarily anything wrong with that. But we're humans need other humans, and we thrive on being with other people. We thrive on that energy, and so I would encourage, organizations, even individuals on your team, or, get out and go for a walk. I mean, even those little things make a big difference in your day.
Claire, final remarks. What do you want one thing for people to walk away with based on today's conversation?
I thought it was going to be about the disconnection.
Maybe we
One
need to
thing
disconnect.
is for us to think about who we want to be. If what we want in life is to be a good friend, a good partner, a good employee, to make a change here, to do this, does how we spend our time align to that? And what might we think about how, time is the most precious resource. Are we using time that reflects those values of who we want to be in the world?
Thank you, Claire. Who I want to be is in this room and having conversations with all of you about mental health. And I really appreciate Morey, Claire, and Daniel for participating in this conversation, along with everybody that's joining us from a variety of places around the country. The more we talk about mental health and mental well-being, the more normalized things become. And I just really appreciate the conversation. We've had this particular webinar for 5 consecutive years. The one up behind me on screen, our next webinar that you'll get a link to register is on anti-racism in the workplace. We've been having this webinar, the anti-racism in the workplace conversation, also for 5 consecutive years, and we're really honored and grateful that we have a few incredible individuals to speak with us at next month's webinar as well. So we hope you can register and join us for the conversation on June 18th, just one day before Juneteenth holiday, on anti-racism in the workplace. So thanks again, everyone, for joining us. Please complete the feedback survey. We appreciate the comments, and obviously you'll need it for your continuing education credits. Stay tuned for the follow-up email that includes the link to today's presentation along with the recording. And again, it's my privilege to be able to be in this space with all of you, with Morey, with Claire, and Daniel, to have this conversation. So thanks, everyone. Have a great day.